Experiencing occasional nervousness or anxiety is a normal part of life. However, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. Often, anxiety disorder involve repeated episodes of sudden feeling of intense anxiety and fear or terror that reach a peak within a minute, which are called panic attacks. These feelings of anxiety and panic interfere with daily activities and are difficult to control and out of proportion to the actual danger and can last a long time. You may avoid places and situations and people to prevent these feelings. Symptoms may start during childhood and teenagers and continue in adulthood. Anxiety can cause physical symptoms, which people may consider as a nervousness or shyness, but it's actually anxiety. Symptoms of anxiety attack may include fast breathing, nausea, dizziness, headache, and more. Anxiety can be the reaction to stress as well as feeling of fear and worry. People can also experience anxiety when there is no visible stressor. There are types of anxiety disorder including generalized anxiety disorder, social anxiety disorder which is also called social phobia, specific phobias and separation anxiety disorder. You can also have more than one anxiety disorder. Sometimes anxiety results from a medical condition that needs treatment. There is no set definition of an anxiety attack in the Diagnostic and Statistical Manual of Mental Disorders or DSM-5, a reference book which psychologists use to make the diagnosis. Panic attacks are different but a part of variety of anxiety disorders. Like those with a generalized anxiety disorder may experience high level of worry until they have a panic attack. It includes symptoms that may feel severe and intense, can happen unexpectedly whether a person feel calm or nervous, include physical symptoms and feeling of terror so intense that a person feel a total loss of control or even death. Often occurs suddenly and usually peaks within 10 minutes before subsiding, although the negative impacts may continue. Frequent panic attacks can be the symptom of panic disorder, which are mentioned in DSM-5. In this video, we are talking about the symptoms of anxiety attacks, which people think that they are shy or maybe nervous, but actually they are not. Feeling nervous, restless, or tense is one of the symptoms of an anxiety attack. Having a sense of impending danger, panic, or doom is also a symptom. Having increased heart rate, which you feel during the anxiety attack, feeling weak, tired, or fatigued mostly all the time, troubling concentration or thinking about anything other than the present worry, sweating and trembling. You can see in the picture how it looks. Breathing rapidly, which is also known as hyperventilation. Feelings of having pins and needles in the body is also a symptom which is very common. Hot flushes, headaches, migraines, and backaches. Having an urge to avoid things that trigger anxiety or having difficulty and controlling the worry with experiencing gastrointestinal problem like nausea and stomach issues, having trouble sleeping, maybe insomnia problem, and sometimes feeling dizziness or lightheadedness. Now, when you need to worry about your nervousness or shyness, you feel like you are worrying too much and it's interfering with your work, relationships, and other parts of your life. Your worriness, fears, and anxiety is upsetting you and it's become very difficult to control it. You feel depressed, have trouble with alcohol and drug use, or have other mental health concerns along with the anxiety. You think that your anxiety could be linked with the physical health problem if you have any. You feel change in your thoughts and behavior. You have suicidal thoughts or behaviors, or you're extremely hopeless about life and future. Your worries may not go away on their own and they may get worse over time if you don't seek help. So remember that you need to see your doctor or mental health provider before your anxiety gets worse.